got a question recently. What is the age requirement for surgery? And there isn't a strict cutoff on either end, too young or too old. Now, in general, I recommend that younger patients wait until they have stopped growing. And I think generally the face has kind of settled and matured, which is maybe somewhere in the early 20s. However, I have operated on younger patients. I have operated on patients under the age of 18 if the parent consents in cases where that is just not going to change with age. So if somebody has a really deviated, really crooked nose and they can't breathe, then often it's indicated to do surgery sooner, even down to 16 sometimes. Similarly, I've done genioplasties, a really big or really small chin. It's just not going to get better with a few more years. So in those cases, I may intervene earlier, but it really depends on the patient, how mature they are. The parents have to be on board. Everybody has to be in an agreement to go younger than 18. And even around 18, I often think things will still change a little bit in the between 18 and say 2022. On the other end, there's no too old, but what I might do is change the surgical plan based on the patient's age. I don't want to be doing a 12-hour huge surgery on someone who's 90, but there are people in their 70s, 80s that are totally healthy and they can go through general anesthesia if their primary care doctor says that they're healthy and they're fit. So, it's kind of like everything that I answer on this app is it really depends on the patient. There is no hard and fast rules because every person is different. So every patient and every surgery and every situation is different and it depends on the individual person.